said it was fine if we had the whole group, the whole exercises medicine subgroup join into that meeting. So we'll make that our official next meeting on March 22nd. But hopefully she'll give us a few little ideas of how to get things started easier, and maybe places to kind of wedge ourselves into the curriculum. But yeah, Stephanie and the students thought that kind of the best way to do it is, if we can start anyway, curriculum in year 3 would be probably the best one to do, but ultimately expanding it to year 2, 3, and 4 with some lectures, and then maybe some clinical experience in the year 5 and 6 for the 5 and 6 year students, or year 3 and 4 for the 4-year students, to get some of that exercises medicine, just work on it clinically. But also there's a program called the IPE, which I'm blanking what that stands for right now. But it's basically involves the pharmacy students, the PA students, and the medical students all get together and work on a case, and trying to figure out a way that we can create an exercises medicine case or a lifestyle medicine case. They can all kind of work through together at some point. I forget, I think it's like year 4 or 5 for the medical students, year 2 for the farm students, and maybe year 1 or 2 for the PA students, is how it all works out together. But just trying to kind of build up to that being the ultimate test, I guess, of their ability to treat exercise and lifestyle medicine problems. So that's kind of what we're talking about. Again, we're going to see what that curriculum from South Carolina, get some pointers on it, but hopefully start using some of that information and get going, wedge ourselves in there somewhere next year in the curriculum.
Thanks, Jay. Yeah, I was able to catch the middle of the meeting, and I felt like the med students were very helpful. I loved having their input kind of guide us a little bit too. So that's a smart decision.
Yes, they're motivated and smart individuals.
Mm-hmm.
Jay, is that a meeting that you want others to be able to attend, or is that a meeting that's just sort of an introduction to what they've got going on in South Carolina?
Yeah, I mean, I don't know exactly what it's going to be. I think it's a nice kind of question session, and definitely an introduction. So I figured the exercise medicine subgroup could come, and if anybody else wants to, they can. But yeah, all virtual. So and she said it's fine to invite whoever. So
great.
And again, if anyone wants to join the curriculum subgroup, just put that in the chat as well. Does anyone have any questions or comments for Jay? Okay, so we can move on to our Walk with the Doc, now Just Walk updates. So we kind of used to start with the Walk with the Doc, but we switched to the Just Walk program just so we can include all healthcare professionals in this. We had originally set our start date for March 12th, which has now been postponed to April 9th just due to Omicron. We thought that maybe pushing it past spring break would also be helpful for recruitment of not only people volunteering, but also the kids as well. So April 9th from 9 to 10 a.m. in Pearson Park will be our first official Walk with the Doc, pending any changes. We do have our flyers that are sent to the printer. We don't have them yet, but once we have them, if anyone wants some to distribute out to their patients, please let us know so we can get those to you. Right now, we're just kind of working on last minute updates. Oh, just a second, my office mate's trying to get in here. So we're just doing last minute updates, and we're meeting pretty regularly with our small committee as well as kind of the whole Just Walk interested parties. So if you want to join that, please let me know. We are working on getting some kids activities, and we have like some enclosed tennis courts. So we're going to be doing the kids activities while the parents walk with us, or we can have the whole families walk together. If anyone has any experience with this or any kids activities they'd like to share, please let us know. Shelley, do you have any other major updates for that?
Well, I'm going to pause for just a second. I've noticed that we have a tiny issue going on. We have 2 KCP plan sector meetings happening at the same time, meaning right now. It looks like a number of people who've just joined us are probably looking for the mass media sector meeting.
Yeah.
I'm looking at Bryce right now to
Yeah,
see.
I'm gonna send a link in just a second. I'll put it in the chat.
Perfect. Okay, so for those of you who are on the mass media sector, this is the healthcare sector meeting, and we are giving some updates about starting a Just Walk program, which is a program, it's an international program where they encourage walking with healthcare professionals. So we are going to be starting on the 2nd Saturday of the month in April, as you just heard Jody say. And what I do want to share with the group is we don't anticipate having to push this back any farther. There have been a number of outdoor activities that the hospital has signed off on us participating in. A couple of them are happening in March, and then this will be the 2nd one happening in April. So we do not anticipate any further delays with getting this program started. We've also reconnected with KU Med. Their Just Walk program has sort of been on hiatus. They have just had a transition in leadership. So the group that was managing their walks through a Health Forward Foundation grant, that group is no longer leading this. They now have students leading their Just Walk programming in Wyandotte County. So we've been able to connect with those students and are trying to coordinate their walks to be on any other Saturday besides the 2nd. And that way participants of theirs and ours would potentially have the ability to walk every Saturday in a month at different parks across Wyandotte County. So we're really hopeful that that works out and can encourage more walking. I'm trying to think of anything else. So if you haven't seen the Sign Up Genius link for Just Walk, let us know. That will be something we'll include in our healthcare sector newsletter updates. I think it's only been sent to people on the Just Walk subgroup. If anyone's interested in participating, again, we always look for 2 healthcare leads. And then we have, Veronica, maybe you can remind me about this, somewhere between 10 and 15 volunteers. Some of the volunteers are helping just with signage and sign in and making sure people who attend know what they're doing. And then another group of volunteers are going to be helping with kids' activities. So we will be encouraging families to attend our walks, and we'll have some separate activities for kids to be able to participate.
Yep, and right now we have the sector leads for currently for April and May. So thank you guys for signing up for those. But definitely we have plenty of room for volunteers if you want to either help with the kids' activities or just with the walk in general.
Any questions? We do have flyers available. We will be distributing flyers to anyone who is interested. Wyandotte County Parks and Rec has asked for some. We will be getting those out to them to share primarily at their Argentine Community Center. We're also working with them to see if we can participate. Well, if we can have a table and let people know about the Just Walk program and when it's going to start. So passing out flyers, they're going to let us know when they have activities going on at the Argentine Community Center over the weeks prior to the first walk. Let's see, what else was I going to say? And for those of you who don't know, I guess Argentine is pretty close to Pearson Park. So we hope that by getting the word out there, we're able to get people who are interested in participating in an ongoing basis. And then we have a couple of people in sports medicine who have agreed to help us get the electronic flyer to USD 500 to share with families across their school district. I'm trying to think if there are any other outreach efforts that we've been working on lately, Jody.
Those are the main one that I can think of. Mm-hmm.
Okay. And if you haven't noticed, it looks like we do have the link for the mass media sector work group in the chat.
So now's a good time too. We have a few minutes. You guys are doing great on time. Great job. So we have a few minutes if anyone, especially new who's joining our team, if they have anything that they're working on that they would like to share with us, any programs or tips and tricks for patients that they feel like have worked in the past.
I guess one kind of thing that Sammy and our team in wellness for HCA have been working on is making a provider toolkit where we're trying to close the gaps between, like we're talking about in the curriculum, what were, our physicians taught in terms of how to even approach the topic of wellness, what types of things should they be asking patients. So we're creating, what types of questions do we need to ask them, as well as, okay, now what do you do with the answer? So trying to work on, okay, you ask these questions, depending on how they answer, this is who we should refer to in terms of closing the gaps for referrals to us, as well as rehab services. And so I think like educating of the own physicians that are within your own facility is huge. And so I've seen even just, I built kind of like a referral list. So if you hear these like keywords, refer to wellness, refer to nutrition, et cetera, within our hospitals. And it's really given an uptick in my referrals from just doing that and broaching those conversations with my providers.
Well, I love that. That is so wonderful. And if you could share that with us once you guys you feel like at a good spot, we would love to have that. Obviously a lot of us work with pediatrics, but I definitely have parents too who could benefit from some of these resources as well.
For sure.
Well, that was a great update. Does anyone have anything else they'd like to share? So just a reminder, we have the billing/reimbursement subgroup. We have our exercises medicine curriculum subgroup and our Just Walk subgroup. Those are typically meeting about once a month. If you would like to join any of those subgroups, please text us, put it in the chat, and we'll get you on those. Our healthcare sector updates, we were talking about maybe starting to spread those out. We are currently doing them once a month, but with so many subcommittee meetings happening monthly as well, it's getting a little bit harder to find Tuesdays that work. So we were thinking about having our next meeting on April 5th, again from 12:15 to 1. So hopefully that will work with you guys. And then we're thinking probably about every other month going forward, and then eventually spacing it out to quarterly so that we can just have those subcommittees meet more regularly. Does anyone have any feedback for that? Shelley, do you have any
sounds
updates?
great.
All right, thanks, Jay.
The only other thing I'll add is about our newsletter updates. So we thank you to Veronica for helping to get our healthcare sector newsletter started. This is how we're trying to communicate with the group on an ongoing basis. So we send a monthly newsletter to everyone who has signed up to be part of the healthcare sector group. It doesn't necessarily go out on a consistent day yet. We hope to get there eventually. If you haven't seen it, we've heard that it might be going to people's junk mail until you tell your, IT system or your mail system that it's not junk. If you haven't gotten one and you've checked your junk mail and don't find it there, please email myself. So ssummer, and that's with an A, but you can see my name spelled on the screen, @cmh.edu, and we'll get you added to our healthcare sector distribution list. So you get those updates on a regular basis. So every month we try to share notes from the meeting in case you missed it. We also try to share any resources if people have brought them up at the meeting. We share information about the Just Walk program, there in what we sent last month, I think there was a QR code that'll take you directly to our web page on the Walk with the Doc website, and it will give you updates about our program. We'll include some of the sign-up geniuses for anybody who might be interested, etc. So if you're not already getting that, let us know. And then I guess you all figured out how to find the Zoom link in the meeting invites. It is a little bit clunky, and that's a change that Evite had over the past 6 months. So sorry about that, and feel free to invite anyone else you think might be interested in this work to the sector meetings. I think that's all.
Okay, great. Yeah, and I had a problem accessing the Zoom link from my computer, so I had to switch over to my phone. So I don't know if that's just like an on-site Children's Mercy thing.
It's,
or
I
what.
think it's a Chrome thing. I think it's the,
Okay.
You've got to be careful about which browser you use.
Browser. Okay,
Mhm.
I'll try that next time. All right, well, you guys enjoy your 2/22/22 day.
That's
Go
right.
have some tacos. Well, thanks guys so
Thanks.
much for joining. We'll send out an invite for that next
Wait, I've got
meeting.
one thing. Sorry that I'm late, but I just like want to share March Gladness with everybody really quickly. Is that okay?
Yeah.
Okay. So I put together a week-long 10 hours of content driven by cause. And the idea is to talk about the power of sports to transform our lives. And I have a whole week of 2-hour radio shows on 1510 and 94.5 FM, the ESPN affiliate. I will send out information through Robin. Robin's going to be on to talk about the Kansas City Physical Activity Plan on Wednesday. Wednesday, we're going to do physical activity, its impact on mind, body, and spirit. Robin suggested that I ask Jay to join me on the radio too, and anyone else that we can think of. I was even thinking that Paul, he put out a really great letter about the mental health crisis that kids are experiencing, and the importance of physical activity to mental health is unequivocal. So, but I just wanted to let everybody know that we're going to have 5 days of awesome content. We've already interviewed Digger Phelps for 30 minutes, he was incredible. Bill Self is going to be on, Christian Brown. Joel Goldberg is going to be one of our guest hosts. Kim Burns from WDAF Channel 4 is going to be a guest host, along with the guys from 40 Athletes that work to bring life skills through sports. And Dr. Catherine Satterwhite's going to come on to talk about the National Youth Sports Strategy. I'm trying to get someone from the Aspen Institute to come on. And we also have the Kansas City Monarchs, Casey Current, hopefully Chris and Angie Long, and trying to get Bob Kendrick and Rob Riggle, but whatever. The whole idea is to bring attention to the power that physical activity, exercise, and sports has to transform our lives. And I just invite everybody to participate. You can help us raise money for Big Brothers and Big Sisters and our game-changing grants, where we are opening up grants for bigs to give littles access to sports. And I'll have Michael Lawrence on with me. I'm going to have a number of different Big Brothers and Big Sisters guests all week to talk about the power that sports plays and the relationship they build with their littles. But it's really just kicking off this whole idea that we got to fund kids into physical activity and sports to help them heal from 2 years of separation and being restricted in their behavior. So invite everybody to check it out, to watch what we're doing. We're going to be on a lot of different socials and putting out a ton of different content. And March Gladness is something that we've done for 3 years, but this is the biggest and the best that we've done so far. It's 5 straight days of radio and great content, and just ask you all to follow along. Any questions?
Thank you so much, Bill. I appreciate that. And if you have a website that you
awesome.
want to put in the chat so we can reference that, that'd be helpful.
Yeah, it's no website, but
Okay, just
I've got
type-
I've got a flyer and I've got I've got a promotional package,
perfect.
and I haven't quite got a website done, so I wish
No
I did.
worries.
If you'll send us that flyer and information, we'll include it in our healthcare sector newsletter
Okay.
update.
All right, I'll get it to you.
Thank you.
Awesome. All right, I'm done. Thank you.
Anyone have anything else? Well, thank you guys so much for taking the time to be with us today. I really appreciate it. We'll give you 10 minutes back to your lunch break.